everyone. My name is Andrew Cosman with ADM Ottawa Physiotherapy, and today I'm going to talk to you about acupuncture. I want to answer what it is and how it works and who can benefit from it. As many of you know, acupuncture uses needles that are inserted below the skin. Those needles can vary in length, and depending on who you ask, you might get a different explanation as to how it works. So if you ask somebody with more of a traditional Chinese background, they might explain to you how, like the blood vessels in our body or the nerves that kind of run through our body, the nerves and the arteries and the veins, we also have channels of energy known as meridians. An injury and illness basically is caused by a disruption of flow in that energy. So acupuncture aims to stimulate those meridians, and by inserting the needles on certain points along those meridians that aim to restore the flow of energy. If you ask somebody from North America who is trained here or who has a little bit more of a westernized approach, they might explain to you how the body releases its natural sort of healing mechanisms and pain reducing mechanisms near the area, which are stimulated by those needles. Almost the same way we do a great job in fighting the common cold or any bug that comes into our system. When we introduce something foreign to that area, the body will send its healing mechanisms to that area. So that might be a little bit more of a Western approach to it. So who is acupuncture for? Basically, any type of pain. There are some people who are not supposed to use it, and we'll talk about that in a second. But neck pain, back pain, fibromyalgia, any sort of osteoarthritis, it becomes an option to help with pain, especially if other things haven't necessarily worked in the past, which leads a little bit into what we want to discuss about the pros and cons of using acupuncture. The cons are very few. If it doesn't work, then it doesn't work. There's not a major time commitment associated with it or investment, especially if you're having it as part of a regular physiotherapy session. There are people who shouldn't necessarily be using it, whether it's for absolute reasons or just for cautionary reasons, such as pregnant women or people who might have coagulating disorders in the blood. These are just people that we want to be a little bit more careful about. Of course, the practitioner will do their best to screen you properly in order to make sure you're a good candidate. But people who can benefit from it are people who've tried other things and don't seem to have any results. People who are not so keen on trying medication. This can be a kind of a non-pharmacological approach to dealing with pain. It's also beneficial in the sense that there's very little side effects that's associated with it. So for people who either are concerned about side effects or who have sensitive systems, this can be an approach as well. Like we said, a lot of people do benefit from it. The research is still ongoing, and there's been a lot of research. And as you might imagine, the quality of the research can vary. But as it stands right now, we have some evidence that people do get relief when real acupuncture is compared to a sort of sham acupuncture, which they've compared in the research. So the research is growing. And at the end of the day, if it doesn't work for you, then there's no reason to continue with it. But just for people to be aware of what it is, who can benefit from it, and why someone might consider trying it. Personally speaking, I've found it to be helpful for some conditions more than others. I'm by no means an acupuncturist, but I do use acupuncture and have found it to be beneficial for some cases. So I do have that as part of the tools that I like to use, in addition to manual therapy, exercise, and balance training, and depending on the needs of the client in front of me. So if you have any questions about that, or if you're interested in this sort of holistic approach that incorporates acupuncture and other forms of treatment, feel free to call 613-820-8765. Thank you.